Hey, Nadia. Hello, audience. I'm wondering if you all are out there having problems with your internet and apps and such. I feel lucky that
Yeah.
we're able to record. What kind of
Mhm.
issues did you have with it's like an Amazon cloud issue, right? It's down?
I have I have no idea, but I couldn't get into my Canvas today, which is what I use to turn in assignments and all that. Luckily, I didn't have any assignments due, so it wasn't really that big of a deal. But yeah,
Well,
can't access that.
your teachers would have to be okay with the assignments not coming in if they were due today and you don't have access to the software.
Right. Yeah. Luckily, I didn't run into any of those issues, so hopefully it's back up. I think Amazon is working again, hopefully so. Or like at
Okay.
least the app. Which is also kind of funny because I've been on Amazon recently for Halloween costumes, so I noticed that the app was down today too, and I wouldn't usually have noticed because I'm not always on Amazon, so but yeah.
Yeah, I wasn't able to fully access all of the things on um, the software that we use to store our patient
Mhm.
interaction notes. And I wasn't able to upload videos to this other app that we use to send patients videos of their exercises, which, like,
Yeah.
wow, like it's like all the things that we do that
Mhm.
get kind of broken down when something big like that gets shuts down.
Yeah, it reminded me of when I was on co-op a while ago, and I like when Epic would like shut down for a little bit and literally nobody knew what to do because we're just so like I think I've talked about that on the podcast, was just we're so dependent on our electronics and stuff online that like when it doesn't work, we don't know. It's like hard to adapt.
Yeah, well, I when I first started working as a physical therapist, all my notes were written on a piece of paper and everybody's files was filed into an actual file cabinet.
Mhm.
So, I feel like I would know how to adapt, but it does make things a little bit harder.
Yeah, and especially in like a bigger clinic that like the health center I was working at, just like a lot at once and, more patients coming in. So it's like you have to kind of figure all that out. Especially as a co-op too, who's just trained using the computer and Epic, like it's hard to not use it because I was never trained to do it on paper. But it's more
Yeah.
straightforward, so it's fine.
Speaking of co-op, that is what I wanna talk about today. I wanna talk about the interview that you had today.
Mhm.
Tell me about what you kind of experience you're looking for and how the interview went today.
Yeah. Well, I'm looking for clinical research for like clinical trials, operations like that realm. That's what I went into this co-op like application semester being like those were my intentions. And so that's what I've been applying to. And it kind of ranges from like biotech companies to hospitals and like research in hospitals. And I've applied to like well, I started in the beginning of September, but it just started gearing up with a lot more clinical co-ops recently in the last couple weeks, last week. But I've applied to like 20 in the past 2 months. And I've only gotten one interview. And I had my second interview for that place today, and I think it went well. But
Good.
or well, knock on wood, I think it went well. But I don't know, co-op process is always so I guess the word I use is humbling, as I feel like at least this time around, I feel pretty confident with my skills and what I can do and like
You
being
actually
able
feel like you have, like, skills to help somebody.
Yeah, yeah, and not even somebody, but, like, a company in general. So it's, like, hard when I don't get interviews back, but I'm also being pretty selective with the type of co-ops that I'm applying to. I haven't applied to any, like, clinical co-ops, like medical assistant or, like, in that realm, inpatient or outpatient. I haven't applied to those yet because I've already had experience doing that, so I wanted to try something new. And my thought is that, like, if I do apply to those, then maybe I'd have a little bit easier time getting, like, interviews or offers, but I know, like, right now, that's not what I wanna do, so I haven't been, you know, applying for those ones, but we'll see what happens.
Well, I was just
I don't
talking
know.
about you with somebody who's a medical doctor over the weekend,
Mhm.
a friend of mine, and I was telling her about your dilemma of pursuing something related to research, but not
Mhm.
really sure that it counts as the type of research that medical schools
Yeah.
consider research.
Yeah.
And you wondering whether or not it's worth it to even pursue something like that. And she said, yes. She's like, she should definitely go for that. Even if it's not something that seems like it's directly for medical school, if she is
Mhm.
interested in it, it will show the school that she's doing things that are of interest to her
Yeah.
and things that like she's doing it for herself. And, you know, she was recalling that she did a internship. I'm not naming her, so I think I can say the details here. She did an internship that she, I think, didn't want or was like in the end didn't like, but she was so
Mhm.
grateful for the experience because she worked directly with Anthony Fauci, and
Mhm.
she didn't always, like, have that as, like, like a, you know, like a
Yeah.
name of somebody that she's worked alongside, so she's like, "Even if there's somebody there on that staff that might be kind of like a big name or somebody that has a connection,
Yeah.
something good is likely to come out of it if she
Yeah.
does her best work there." So,
Yeah.
that was her
Yeah,
advice.
I think, like, yeah, hopefully that is the goal because, yeah, like, I don't know. There's a lot of factors that have gone into the ones that I've applied to so far. But after my conversation today, I mean, if I get the job, then maybe I could talk more about it. But after my conversation today, I felt better about like why I applied for it because I don't know. It sometimes the most like direct not direct, but like it feels like the right answer would be to do a clinical co-op, and maybe it is for some people, but I think for me, I need to explore other sides of healthcare, ones that like I hadn't previously considered as an option, um, because there might be something that I'm missing. But yeah, so we'll see what happens. Um, I'm also getting kind of tired of applying to co-op, so I'm like hoping that this one or at least one of the other ones I've applied to will like work out, but I should probably I don't know. I'm not like trying to bank on this one co-op, but I'm also like don't want to apply to things I'm not interested in. So it's kind of a hard battle. Feels a little bit like applying to colleges, but not really. But yeah, I don't know. We'll see what happens. Hopefully we talk in January or in our January episodes and I have a co-op, but TBD. But yeah, so we'll see.
I mean, this is just you and a semester in school. Just, I hate to be a Debbie Downer, but think about what it's like for people that are looking for jobs and they
Yeah.
have children and they have a mortgage or rent for their house
Yeah,
and car payment. Oh my goodness.
totally.
So
It's
much
like
pressure.
yeah, so it's like I'm trying to like make the most of the opportunity, which is why I'm also trying to expand a little bit on I think my thought and this is like with conversations I've had with other clinical no, other like pre-med students and other that would be it will probably be a little bit easier for me to get like an internship or volunteer job or actual job in a clinical setting as a medical assistant or something of that sort since I already have experience doing that and really just want to use my like northeastern resources while I still get or to try new things and hopefully like I don't know find other things that I like. Yeah. Yeah, so we'll see.
I'm not really sure. I'm trying to think about what the theme of this conversation is. It's just kind of like a catch up, but I do have another somewhat related topic.
Mhm.
So we were talking about how people like might need help, like, might have a hard time looking for a job. And there's
Mhm.
definitely people out there right now that are stressed out about not having a job
Mhm.
and having to pay for all their family expenses. And today, I was like, one thing that like is troublesome is when
Mhm.
people don't have good access to healthcare
Yeah.
because they don't have insurance.
Mhm.
And I'm embarrassed to admit that I'm not paying too much attention to the news these days.
Mhm.
But someone brought up in one of my classes today about services that are being taken
Yeah.
away regarding the affordable healthcare and also
Mhm.
food stamps. Are you talking about that at all in your classes? Can you update me?
No, well, not really, because I am taking one public health class this semester, epidemiology, that it's not necessarily the realm of what we're talking about. But I was taking my health policy class I took last year. This would probably be things I discuss like pretty frequently. But I did see that there isn't any like EBT or SNAP for November. I don't know if that's what you're talking about.
Yes.
Which I
What?
think is kind
People are
of
gonna be hungry?
insane. Yeah. I also probably shouldn't, like, I'm not that I shouldn't be saying it, but I am also embarrassed to admit that I haven't been paying that much attention to those, like, little things. Like, I see the major headlines, but I didn't know, all the little things that were going on. And obviously it's coming from a perspective of I don't like depend on food stamps like EBT and stuff. So I didn't notice that that was happening, but it's crazy. And I think like maybe if I was working at that health center that it would definitely be a little bit more relevant or I would see it a little more often, or the effects of it. But yeah, it's pretty crazy. I don't really know how this helps anything, but like I'm
I
not
know. When I
quite
was asking,
sure.
I was like, "What is the justification?"
Yeah, I don't know.
Because we supposedly can't afford it, but then there's, like, billionaires out there. I don't know.
Yeah, I don't know, it's crazy.
Benefiting from what the government's doing, but
Mhm.
billionaires, I mean, but not the people that are just the everyday person that needs some help getting
Right.
some of the life basics. So one of the jobs that you had, one of the very first jobs that you had was working at a
Mhm.
grocery store.
Yeah.
And did people often come in paying for their food with food stamps?
Yes. But it was like I'm pretty sure it's like they have, like, a credit card.
Mm.
So, it wasn't anything that I had to process on my end, but I do remember, like, they had, like, a specific card to use at the grocery store. So, it wasn't like I don't really know. I didn't know the process before, but yeah, people would come in and ask if they took it, and then I'd say yes. However, now that I'm talking about it, there are like little things. It's like you have to be very specific with the things you buy because some things aren't covered by EBT and some things are. So, like, I think it would be like a situation of like they tried to pay, but it wouldn't go through because one of the things that they had bought, like you can't pay. So sometimes people would come up and have like two separate things, like two separate baskets. One, they're going to pay with EBT and the other one they have to pay on their own because it's not covered. But which like in the general sense it makes sense. You don't want that people to use the EBT money on like just anything. So it's like mostly like fruits and vegetables, like all that kind of stuff, but like the necessities. But yeah, people use them all the time.
Were you ever, like, surprised about did you ever have any uncomfortable situations or surprised about the way somebody presented, versus
It was a long time ago, so I don't think so, but maybe more uncomfortable interactions in the sense that like I was new and that was my first job and I think maybe there were interactions of like I didn't realize they were playing with EBT, like in that sense, like I just wasn't aware, or like things wouldn't work, and then I'd have to be like, oh, it didn't work, like that, like those situations. Payment problems in general in like that kind of setting are just a little bit uncomfortable. But yeah, it was nothing like crazy.
And you're looking for research work because you don't have much, but I do seem to recall you working for a program or professor at your
Yeah.
university. And what kind of research were you doing, or what kind of research were you assisting with?
So, like, basically all of last school year, I was working with a public, or actually, she's a sociology, I'm pretty sure, professor. And she was doing research on sanctuary policies in the United States. So it was a little bit different. It was like through the Institute of Social Justice and Health Equity at Northeastern, and it was like a health equity intern position that I had during the fall, and then I continued during the spring. It's yeah, I helped with a lot of, data. I did a lot what was the word? Like, policy scan. So I'd go on Google and, um, find policies from all 50 states regarding certain sanctuary policies, which are policies that, like, can either help integrate or criminalize, or most they're integration policies for undocumented immigrants in the United States. So, like, looking to see what states allowed, like, speaking on what we were just talking about, like, which states allowed undocumented immigrants to have access to SNAP benefits, which is a lot more complicated than you might think. I think that was probably the portion of my research that I spent the most time on, because it was just so hard to find concrete data. And I can't even imagine trying to figure it out as an undocumented immigrant in the United States. But yeah, so it varies. I mean, I'm sure you could probably imagine it varies from state to state, but yeah. So I did, I've had public health research, which I loved and would obviously do again, but nothing relating to science. And I mean, yeah, not all the jobs I've applied to in clinical research are like wet lab experience, but mostly just like, if it's not wet lab, it's like in the general vicinity, like it, at least like in that field a little bit.
Yeah, your public health research sounds really, really interesting. So wait, what
Yeah.
did you say? Access to what benefits? Which undocumented immigrants have?
So it was like there was some other students that were working on this project as well, but a lot of the ones we all had certain policies to keep track of, or to research for all 50 states, and mine I had were like access to SNAP benefits, or
Snap.
yeah,
Snap.
SNAP
Okay.
benefits. But I also looked into prenatal care, and there was a lot of other ones, and now I'm blanking.
I
But a lot of the
f
ones I was doing were really
It's really interesting that we're, like, wanting like, there's the issue of people, undocumented immigrants having access to certain benefits. That's one thing, like, do they even have access? Can they get them? But the other thing is, are they reaching out and actually accessing them? Because I think that a
yeah,
lot of people who are undocumented just kind of want to, fly under the radar and not, you know, have
yeah.
any record of them accessing anything because they're afraid they're gonna get caught.
Yeah. So I think, yeah, that is like the main thing. And I was only like the beginning process of this research, and also I was helping this professor, but I also think she had been working with another outside. She does a lot of research on her own as well in this realm. So I'm not sure what the end goal of it was. And the idea in my head would to be like using my research and the other students' research to like build a list of resources, or like at least like, I don't know, building awareness on what things they do have access to based on where they live. Like, I don't know, like things like that. But yeah, I wasn't really doing research on, the front end stuff, but mostly like which policies are in place and when were they put in place. So
Mhm.
there's a lot of like dating and stuff.
So bringing it back to what we talked about last week a little bit, which was
Mhm.
going to medical school, becoming a doctor,
Mhm.
and connecting with what's going on, right? What we're talking about today, which is like all the experience that you're trying to collect so that you can be the best possible doctor.
Mhm.
I'm thinking that a good physician, a good medical doctor would, of course, have knowledge. And that
Right.
is what you're going to get from school. There's not much you can do to be able to know what a doctor is supposed to know
Right.
unless you go to medical school and learn from other doctors. But outside of that are equally important skills like communication skills,
Mhm.
an awareness of the different social determinants of health and all the things that are out there in the world that affect people's health. So an
Yeah.
awareness and acknowledgement of all of that.
Mhm.
And then compassion, like seeing empathy, like opportunities to learn about different people and their different perspectives and places in life so that they can have more compassion and empathy for the patients that come in.
Yeah.
And I mean, I think that's it, right? Like knowing the big picture of your patients, knowing how to communicate to them, and then knowing the different places from where they might be coming from so that you
Yeah.
can best communicate with them.
Yeah.
Do you think that's it? Those are all the components of being a good doctor and
I mean, I feel like those are definitely the main, like, important ones, but I feel like you can't really know. There's no, like I feel like there's no, like, concrete list of, like, what it means to be a great doctor. You have to I don't know. Feels like it'd be a never-ending list. But those are definitely the main ones.
so I think you can be pretty proud of yourself for like collecting all of these like soft skills.
Mhm.
You'll go into, learning the,
Yeah.
actually I did say that after time, not only
Mhm.
will you know the things that the doctors need to know, but over time you'll build your clinical reasoning and
Yeah.
know because you'll have experience of clinical patterns that you recognize. And so that's part of it too. But none
Yeah.
of those things can happen until you actually go to medical school, have the knowledge
Mhm.
and actual patients.
Yeah.
But
Yeah.
everything else that you could gather before medical school, I think you've done a good job over the past 4
Yeah.
years
I
collecting.
mean, I hope so. And even during my interview today, and I was like and it's not very often that I have to, like, talk about my old jobs, so I have an interview because, like, why would I? But I felt pretty even if I didn't like, even if it didn't go as well as I thought it did, like, I still felt pretty confident talking about my roles in the sense that I don't know, I know the skills that I've learned and how it can be applicable in other settings, and it felt like obviously I prepared for it, but I knew what to say, so that always feels good. Just to feel, like, good in the skills that I've gained over the past 4 years, and, like, looking at all the jobs I had in retrospect, like, all of last year, I felt like I wasn't doing anything, like, I felt like I wasn't doing enough, and I look back on it and I was, like, working and doing research at the same time as taking classes and doing gym save and all that. So, I don't know, puts things into perspective, I think.
I guess speaking of gym space, that's another skill you need to have if you're a physician is
Mhm.
being able to work with a team. And so you being the president of that student board is a
Yeah.
way you're like working with peers, trying to
Mhm.
carry them to goal.
Yeah.
Nice work, Nadia. Last night I watched a TV show that maybe both you and I just yet another medical
Mhm.
TV show, and it's called
Which
Doc.
one? What is it on?
It's on Netflix. Have you heard of it? Doc?
Maybe? There's
Okay,
just
here's
so
the
many
premise.
I haven't been watching medical shows, maybe it's for a reason, but, like, a unknown reason, like, an internal reason, but I
Okay,
haven't
here's
been
the
watching
premise.
a lot of Okay.
There's this female physician, and she is really good, like she's got all those skills, the ones that you don't
Mhm.
have yet, like the clinical pattern recognition,
Yeah.
knowledge. She knows what tests to look for. She knows all, she's
Mhm.
like good, right? But she's not nice. She's really has a really poor bedside manner.
Mhm.
And she's worked so hard and is so good that she's now chief of internal medicine. And what happens is she gets in a car accident and she has a brain injury.
I did see this. She
And
loses her.
because of the brain injury, she has forgotten the last 8 years, which are pretty much the 8 years in which she had like a real rise in her like
Mhm.
career.
Yeah.
But it's also in the past 8 years, that's when she became a not nice person.
Yeah. So
And
then
so she's,
she comes back.
yeah, so she comes back and she's lost the last 8 years, but she's back to her old, like,
Mhm.
yeah, nice, compassionate self.
Mhm.
And so it's interesting. And I've only seen one episode. And so I think maybe you and I should watch it and see how it goes because there's more details to it that I don't want to give away on podcasts that are like kind of compelling and makes me want to see where it goes.
I'll add it to my list of shows I have to watch on top of the other things I have to do. However, I low key would put shows at the top of my list. I love TV shows so much, so I'm always happy to
How
add
many
it.
times have you watched Grey's Anatomy now?
You know what's actually funny? I think I watched it 3 times, like, in high school, which is kind of crazy because there's a lot of episodes. Um, but now, like, being in college, watched only I've watched, like, 8 seasons. I think this was last semester. I watched 8 seasons, and then I couldn't go on. Like, I got bored. But I did get an ad the other day of a new episode coming out from Grey's Anatomy, and I'm very intrigued to see where it has ended up, but I forget what season I stopped on, so it just feels like too much of a time commitment. So,
I was
however, I
talking.
am on, like, my 5th run of Gilmore Girls at this moment, so
Oh, wow. So Gilmore Girls is the one that you've watched the most at times?
probably now, yeah. And I, like, would watch it again and again, and I don't know. There's just something about it.
I don't even understand this. I've never watched a TV show or read a book or twice. I've watched movies more than once, but like I'm not interested in going through a whole series.
Well, it's just like it is very much a background thing. I need background noise and sometimes I get tired of my music. And sometimes well, obviously I like watching it. So, but I don't know. It's very comforting
I
for
can see
me.
that.
But yeah, I
All
forgot
right.
what your question was before, so.
Well, it's just about medical shows. I feel like I'm not really sure what the theme of this conversation was. Basic catch up. And actually, maybe the theme was like all your job experiences and your skills that you've gathered over the years. And I'm hoping I wanted to hear about them. The main reason was I wanted to hear about your interview today, but I'm glad that it went well. And I can't wait to hear about what offer you get.
If I get one. But I will, but we don't know when.
All right. Well, have a good rest of your day. Bye, listeners.
Bye, everybody.